How to help relieve gas in babies. First thing you need to do is recognize the symptoms of gas, like pulling up her legs, clenching her fist, scrolling around as if she's uncomfortable, crying a lot, fatigue, or burping. Although there's no evidence for a connection between colic or excessive crying gas, some people may link the two conditions, identifying signs of gassy babies. Do the bicycle with baby. If your baby seems gassy, lay her on her back on a stable surface, then begin moving her legs in bicycle motion to help move her, expel the gas. Also, give her some tummy time. Every baby needs tummy time to straighten their upper bodies and keep their heads up from getting flat. You can also massage baby's belly, move trap gas in your baby's belly by massaging it. Not only can this help relieve gas, but also can soothe them. Swaddle your baby. There's so many evidence that swaddling baby can help relieve gas. So if your baby is under 2 months of age, try swaddling them and give them comfort. Rock, bounce, and hold your baby. Some babies expel gas when you move together with them or hold them in a certain way. Try rocking, bouncing, and gas hold if your baby seems gassy. Also, burst the bubbles with medication. Although study do suggest that not really effective against gas. Talk to your pediatrician about this. You can also consider the prohibit. Again, talk to your pediatrician about this and gynecologist before giving her any colic medication. See your doctor. So tell your doctor what you've done to relieve the gas and if it's been effective. Give the doctor any helpful information about your baby. So how do you prevent gas? Soothe your baby if they're crying. Crying may cause your baby to swallow extra air, which can lead to gas. Feed effectively with bottles. Okay, so baby who are bottle fed are more often prone to gas because of the air in the bottle and the nipple. Also, optimize your nursing experience. Breastfed babies may have less gas than bottle fed babies because that breast doesn't trap air like bottles. So you can also try hold your baby upright during and after feedings. Keep your baby upright as possible during her feeding time. This can relieve some gas. Burp your baby frequently, you guys. Place your babies upright on shoulder and pat her back. Sit her up straight on the lap and lean forward to straight and rub them gently. Also, discourage any kind of extensive sucking, like many babies are soothed by sucking on pacifier or empty bottle nipples. Avoid doing all that stuff, you guys, if you want to prevent a gassy baby. Also, just keep one thing in mind is gas pain is very common in babies and it can cause your baby and you discomfort. So gas is often caused by swallowing air when crying or feeding or from digestion process. Even though gas can cause pain for your baby, it is generally harmless. So by promoting the release of gas and preventing it, you can help relieve your baby's gas. And I always do one thing is all babies, of course, pass a little gas, but look for these signs and symptoms of babies' gas. That's more than just usual. Unfortunately, most infants outgrow them by the time they're 4 to 6 months old, though some of the babies can take longer. So infants are usually gassy because they have immature digestive system and swallow air feedings during their feeding time. So some babies may have sensitives tummy that could relate to a breastfeeding mom's diet or certain type of formula. In my experience, I had to change my formula because my baby was gassy. So try changing up formula, you guys. So burp your baby as much as you can and control the airway as much as you can as well. So whether his or her meal come from breast or bottle, try feeding your baby in upright position to cut back on any air that they might swallow. So if you're breastfeeding, be sure your baby is properly latched. For bottle-fed babies, test anti-gas nipples and bottles. So Dr. Brown bottles work amazing for colic and gassy baby. And try any gas drops as well, you guys. So encourage a lot of tummy time. Give your baby a rub down and test new formulas like I have mentioned before. And if nothing worse, talk to your pediatrician, talk to your doctors, and before giving any infant gas drops, just talk to your provider because you don't want to give them something that they get more gassy about. And yes, breastfeeding can make a baby gassy. It's just depend on what you like. What does a mom eat and mom intake in her diet? So just know the differences between gas and colic. So because gas can make babies fussy, it might seem like gassy babies like colicky, but colic and gassy are two distant conditions. So colic in babies has many causes beyond any underdevelopment digestive system, including overstimulation and immature nervous system. Not sure if fussiness is caused by gas or colic. A baby is often colicky because he has heard or she has hard time self-soothing. So your baby is more likely to suffering from colic than gas. If they are typically, start crying around the same time of the day, often early in the morning, especially if those crying bouts last for at least like 3 to 4 times in a week, talk to your pediatrician. So colicky babies are often inconsolable and have episodes of frequent instant crying that can turn into screaming for long stretches of time, even though they are healthy. So when to call a doctor for gassy baby? Your baby isn't gaining weight. Your infant frequently doesn't want to eat or is hard time feeding, possibly side of acid reflux in your baby. Your baby seems constipated all the time. He or she has hard time with bowel movements. Ask a doctor, ask somebody for help, and go talk to your pediatrician. Your baby has allergic reactions like hives, vomiting, rash, swollen face, trouble breathing after you tried new gas treatment or formulas through these allergic reactions. Unfortunately, these are extremely rare cases, but talk to your pediatrician about it. So if your baby is gassy but gaining weight and peeing and pooping normally for his age, everything's probably going to be exactly as expected, and you'll just likely need to wait it out. But baby gas does go down in PUN immediately. So if this video was helpful, do comment below and let me know how did you relieve gas from your baby.